COVID caused the inflammation of the entire body.
Absolutely.
We were concentrating on our saturations. Everybody bought a pulse oximeter, right?
Yes.
Yeah. And everybody got a CT score done for their lungs, right?
Correct.
Because saturations were dropping and we thought it was affecting the lungs. But COVID has affected the entire body. Bradycardia is a term we use when the heartbeat starts to become slower. Pollution affects the heart coronary arteries. It damages the coronary arteries and causes the blockages in the arteries. It damages the lungs because breathlessness starts to occur, and the lungs as such, they become totally tarred because of the smog or the smoke that is there in the air.
Welcome to Health Chacha with Medtronic, the podcast where we decode complex medical conditions, share expert insights, and bring you closer to breakthrough therapies that are redefining patient care. I'm your host Kartik, and today we are talking about a condition that often goes unnoticed, bradycardia, or an abnormally low heart rate. Joining us today is Dr. Vanita Arora, who is India's first female cardiac electrophysiologist and a pioneer in advanced cardiac pacing and arrhythmia management. She is currently working as a clinical lead and senior consultant cardiac electrophysiologist at Apollo Hospital, New Delhi. With over 3 decades of experience, she has performed thousands of complex procedures, including radiofrequency ablations, leadless pacemaker implants, and conduction system pacing. She is the first in Asia Pacific to perform a live leadless pacemaker case, and she will help us understand what causes bradycardia, how it can be diagnosed early, and how leadless pacemaker therapy is transforming cardiac care for patients across India. First of all, thank you so much, ma'am. We are delighted to have you on this podcast, and I'm really sure that the listeners and the viewers are going to have a lot of wonderful insights from an experienced professional like you.
Thank you, Kartik. First of all, thanks for the kind introduction, and I'm sure we'll enjoy the discussion.
Well, so many accolades, and you're wearing them like, souvenirs that are shining proud on your shoulders. And 3 decades is a very long time. And we are talking about a condition, like I said, bradycardia is something that has been ignored for so many years now. And now that right after pandemic, people are getting back to their life cycle, getting back to their health, and they are thinking about how to make sure that we stay healthy, how to make sure that we stay fit. Now people are getting aware about what health conditions they could suffer from and what are the precautions they need to take care of. So some of the insights that I would love to have from you, because you are a seasoned professional, being in the industry for more than 3 decades, is something that certainly warms the cockles of our heart to have you inside a studio. First of all, ma'am, before I start this podcast, bradycardia, a term for all the layman people out there who are listening to us, who are not really aware about the medical jargon. What is bradycardia and what causes bradycardia?
Bradycardia is a term that we use for an arrhythmia. Arrhythmia is misbehaving heartbeats. Normal heartbeats, misbehaving heartbeats. So bradycardia is a term we use when the heartbeat starts to become slower.
Okay.
The normal range of heartbeat is around 60 to 90 beats per minute. Less than 60 is bradycardia. More than 90 is tachycardia, which means faster heartbeat.
Okay.
So your abnormality of heartbeat can be both sides. If you have a heartbeat which is less than 60, it is a matter of concern, especially if you are having symptoms along with it. Sometimes what happens is, Kartik, that like athletes, younger guys who are being trained themselves to be an athlete, like we were talking about mountaineering,
Yes.
right? You need a proper fitness protocol for that also,
absolutely.
right? And you keep running, you build up your stamina. With that, there is a control of heartbeat which is achieved by the heart.
Absolutely.
Right? To give you a good cardiac output. So if you look at the younger guys who are athletes, their heartbeat is anyway controlled, 45, 50 beats. That's normal for them, right? Now, there are some medications which are given for blood pressure control and all. They also control the heartbeat. So they can also keep your heartbeat between 55 to 60. So one has been functionally controlled heartbeat.
Correct.
Second is drug controlled heartbeat. And third is degenerative heartbeat, slowing of the heartbeat, right? That is age related.
Okay.
Right? So when this age related heartbeat becomes less than 60 and it starts to give you symptoms, then it becomes a matter of concern.
Okay.
Now, post-COVID, you have rightly mentioned that we are trying to get back to the normal healthcare. But the problem is that during COVID, what we didn't realize is that our heart also got affected with COVID. COVID caused the inflammation of the entire body. We were
Absolutely.
concentrating on our saturations. Everybody bought a pulse oximeter, right?
Yes.
Yeah. And everybody got a CT score done for their lungs, right?
Correct.
Because saturations were dropping and we thought it was affecting the lungs. But COVID has affected the entire body. The inflammatory process it has caused in the whole body has also affected the heart, causing the
Absolutely.
inflammation of the heart muscle that is known as myocarditis. Now, myocarditis is caused in any ways. It can present to you as heartbeat problems, as heart muscle problems, as the clot formation in the heart arteries of the heart. Heartbeat problems are actually missing in the entire spectrum. We are seeing every day so many youngsters coming with the heartbeat problems now, and that has been post COVID. So, slowing of the heartbeat, increasing of the heartbeat in the youngsters is happening like this.
Ma'am, you rightfully said that many people also associate heart problems saying that we have a faster heartbeat or there can be a blockage. And like we were talking about pandemic played a huge role in countries' healthcare in terms of how revenue was being generated, how people were taking care of themselves, how as a society we were trying to help each other out. And now we are living in a city which has an air quality index of more than 400.
Absolutely.
It's I mean, for somebody like me who is very particular about what to wear, how to go outside, what are the precautions that one needs to take care of, I am very concerned as a human being that I am living in a city which has an AQI of more than 400, 500 on a regular basis, and it's on a severe level. I'm sure that this also has an effect on heart as well. Am I right?
Yes, it does. It does. See, the pollution affects the heart coronary arteries. It damages the coronary arteries and causes the blockages in the arteries. It damages the lungs because there are breathlessness. The breathlessness starts to occur, and the lungs, as such, they become totally tarred because of the smog or the smoke that is there in the air. So, with this lungs problem occurring very frequently and the heart problems also occurring, the heartbeat starts to tend to go up. Patients start having tachycardia. The heartbeat becomes faster, and it needs to be controlled.
One of the major reasons why I asked you about the air quality is because there are lifestyle changes that are happening. There are people like me who are at the age of 30 or a little younger than me as well, who are working in corporates, who have a certain lifestyle now. They are working at very odd hours. And obviously, because of that, there is probably a situation because of which bradycardia might be diagnosed in somebody or the other. And how common is bradycardia right now in India?
Okay, first of all, corporate lifestyle, our lifestyle has got nothing to do with bradycardia,
Okay.
right? Until and unless it is, see, bradycardia per se is a degenerative disease. It's an age-related disease.
Okay.
The incidence of bradycardia in youngsters is very, very rare,
Okay.
right? And it can be associated with congenital heart disease, like you are born with some congenital defects, then you can have slower heartbeats. Apart from that, it is actually a disease of the elderly. As you start aging, you can't stop aging by any means. Similarly, which out of 100 individuals which have other specifics as the same are going to have a slower heartbeat, we do not know. It is the time will tell as they age. Until and unless they have some kind of ECG changes which are occurring, which can be picked up early, and then they can be put up to get a proper follow-up done every 6 months or every year to look for any symptoms or diagnose the early symptoms and give them the therapy.
Correct.
Bradycardia is an age-related disease.
Okay.
And it is like you cannot stop aging. You cannot stop it from coming there.
So I'm sure that has nothing to do with as far as the lifestyle changes is concerned, as far as
No.
the corporate life is concerned. But how common is bradycardia becoming in India? Because now that people are becoming aware, they are going to their respective doctors, they are going to healthcare professionals, they're getting themselves checked. How common are you as a professional in the industry? How commonly are you seeing bradycardia cases these days in India?
Okay, Kartik, first of all, you have to understand that in the rhythm problems, in the heart rhythm problems, which means heartbeat problems,
Correct.
diagnostics is a big challenge. Diagnosing it at the right time is a big challenge because people refuse to get themselves investigated. So diagnosis wherever, now we have very wonderful diagnostic tools available. We have patches, we have ELRs, external loop recorders, a small patch which can be put on the chest and it can work up to 24 hours recording the ECG
Okay.
of the patient, right? So earlier we had cumbersome halters available or loop recorders available, and they were available at very few places. Now every small city in our country has these diagnostic tools available. We have so many companies. It's kind of a, you can say, like you were calling it a corporate life, right? It's a
Correct.
corporate boom which has come up to our diagnostics because doctors, cardiologists especially, they realize the importance of that missing link between the patient being diagnosed early and given the treatment so that they are healthy. Most of the time, what would happen is, earlier what used to happen was, elderly person would go off to sleep, will never wake up, right? Because he was having slower heartbeat. It never got diagnosed because they never went to the doctor. They never got the diagnosis done or an ECG done to have a diagnosis. And even if you have a baseline ECG which is normal, it is very important in case there are symptoms. Those symptoms have to be analyzed in the correct perspective, and longer term ECG recordings have to be done in form of ELRs or in form of sometimes we do an EP study, electrophysiological study, which is a diagnostic study, and it clinches the diagnosis like quick. So once you get the diagnosis done, you need to get the treatment done. Here I want to add another fact here, Kartik. When you have bradycardia, you do not have any medication available for that.
Absolutely.
Right? You have tachycardia, we have medicines which can slow down the heartbeat and which can keep the heartbeat controlled. But when you have slower heartbeat, the only way to treat is to go ahead and get a procedure done. Now, here I give an example. Suppose in your house, right, your electricity of the house goes away. What do you do?
We generally call the electricity people. We call the board and then we ask them to make sure what is going on. They diagnose the entire situation and then they make sure they repair everything.
Yeah, they repair everything.
Correct.
Suppose it is unrepairable. It's all gone. Right? The wires are all gone. What do? You put in a backup inverter or a generator. So this pacemaker, I always compare it to being like a generator or an inverter of the heart. The electrical wires of the heart are broken. They are degenerated means they are broken.
Correct.
Right? They cannot be connected properly again. They cannot do that. There is no way in the world. I wish we had some pill or some, fluid which we can put in the heart and it repairs the things. It doesn't. It doesn't come like that. So what you have to do is you actually have to put in a pacemaker which acts as a generator or an inverter, and it restores the heartbeat back again. If you have a heartbeat problem, please reach a cardiac electrophysiologist. Now, coming back to the second part of the question which you said, that how frequently am I seeing this? Post-COVID, I am seeing arrhythmia problems, heartbeat irregularity problems a lot, right? And from the elderly perspective, one thing has become good in post-COVID is people have become more conscious of their health care.
Okay.
It has improved. Them becoming more conscious, coming and seeing a doctor and telling I have this problem, it has become much higher than what it used to be before. Because probably COVID has made us realize that our health is very important. Yeah, we can go like this.
Correct.
So being healthy is more important. So people coming to me for diagnosis has become more. And I'm sure my other colleagues are also seeing the same thing. And they have become more receptive towards getting a diagnostic tool being used on them to give them an early diagnosis. See, if they come and I tell them get an ECG done. Now, at that time, ECG may be normal. but they are having symptoms. So I need to listen to them. I need to analyze.
Correct.
Symptoms have to be analyzed in the correct way. It's like a storytelling. It's like storytelling.
Absolutely.
If they tell me the part of the story correctly, I can connect the links and give them a proper diagnosis.
Correct.
Sometimes to make that diagnosis, I require some tools like extended ECG recordings or doing an EP study. So their acceptance to this thing has improved.
Okay.
When I tell them that I need to give you an answer, so this is my hunch, this is my feeling from the story you have told me. Now I have to corroborate the data with the diagnostics, and then give you a proper line of treatment. So this becomes important.
And ma'am, coming down to my last question, leadless pacemaker, a new representation, a new technique that has come into treatment of bradycardia. I mean, how does this therapy actually differs from the traditional diagnosis and the traditional ways of treating bradycardia at this point of time? Because this is something new. This is something that a lot of people don't really know about. So can you shed some light upon that as well?
Sure, that's my passionate subject. You were saying it's a last question.
You have done a live leadless pacemaker therapy.
That's correct.
Please.
Yeah. So, see, there are few technological booms.
Correct.
Which occur in our total professional tenure. So, leadless pacemaker is a technological boom which has occurred in the world of pacing. Okay. I did my first case 2016. And it was amazing to see how this technology works and how quickly patient recovers and how things have moved forward in last 10 years is amazing.
Okay.
Now, traditionally when we do a pacemaker, we do a small surgery. It's done in the cath lab, but it is a surgical incision. We give a small incision in the chest below the clavicle bone.
Okay.
And we take venous punches to put in the leads inside the heart. Now, over the time we have seen there are a lot of challenges which start occurring in patients who are given the traditional pacemakers, and the leads form the Achilles heel of this procedure. Okay. You see, the first prototype, the implant pacemaker, was done in 1967, 66, 67, right? And 1970 was the first prototype of leadless pacemaker made, and the paper was published. So within 3-4 years, our seniors, our able, physicians, they realized that what is the Achilles heel, where is the problem with the pacing going to be?
Correct.
So over all these years, the technology has developed beautifully to reduce the size of the pacemaker, to go away from the leads. So at the trajectory, the battery has all been compressed into a small vitamin-sized capsule.
Oh, that's wonderful.
And the leads have been transferred to nitinol tines. It's like kunde jaise bolte na. The kunde, this is the shape. This is the hook shape thing. So they are the tines, we call them. And the small size capsule, I mean, you can put it like this on the palm. It's a small vitamin size pill which is there. So it is mounted on the catheter. Okay. Right? Through the vein of the leg, we put it in the right lower chamber of the pacemaker, of the patient. Right? And we take out the catheter and patient is ready to go home within 6 hours. Correct. Right? The part where the conventional pacemaker patient used to stay for 2-3 days in the hospital, then there used to be an immobility of the arm because leads have to become the part of the body. Then the wound has to heal. Antibiotics have to be given for a long time. There should be no infection. There should be no hematomas. That is a collection of the blood in the pocket when we are doing the dissection. So all these things have been taken care with the leadless pacemaker because no wear and tear of the leads. No lead fractures, lead breakage, insulation break, no hematomas, no infection. In fact, in active infection, sometimes patients, they get the implants done from somewhere. They come back with the infection and extrusion. So in those active infection patients, I've taken out the device, taken out the leads, cleaned the pockets and implanted the leadless pacemaker at the same time. They have become a solace for such patients where problems are there.
And for a long term outcome, if we talk about, I'm sure that this has certainly been like, devil's advocate now that there is leadless pacemaker, and it's literally of the size of a vitamin pill that you're talking about. And I'm sure for many years, people who go through leadless pacemaker therapy, they don't feel a lot of discomfort comparing to the traditional ways how treatment was done as far as bradycardia was concerned.
See, each and every patient in whom I have implanted the leadless pacemaker has come back to say this statement. I don't know, did you really do something? मुझे तो पता ही नहीं लगा आपने कब कर दिया. मुझे तो लगता ही नहीं है मेरे को कुछ किया. Because there is no weight of the pacemaker in the chest.
Correct.
Right? The pacemaker, traditional pacemakers, they now are very small devices, but there are 2-3 grams, weight is there, right? And then restriction of arm is there. Sometimes the leads, they have some stretch. So they feel something in the chest.
There is a problem with flexion, abduction, and extension
there
as well.
Can be, yes. So but leadless pacemaker, it's just been placed in the heart, right? It is pacing well. Patients don't even come to know that they have a pacemaker. And invariably they've come and told me that हमें तो पता ही नहीं चला कब कर दिया पहले तो. दूसरा हमें तो लगता ही नहीं हमें कुछ हुआ है. We just leading our life in a very good way. And technologically now, the leadless pacemakers have advanced so much. You see, conventional pacemaker have a battery life. You always have to replace the battery. Even leadless pacemaker have a battery life. But a conventional pacemaker, best of pacemaker in the world, have 10 to 11 years of battery life.
Okay.
Now, initially the first generation of leadless pacemaker gave us a kind of an impression that they will last for about 12-13 years. Okay. Right? Now the latest which have, they work so much on battery life, the latest which have come, 15 years plus battery life, 16 years plus battery life, which is amazingly good. It's really good, which has the thing which has happened. So these are all technological advancements which are occurring. Initially we had a single chamber pacemaker which would pace a lower chamber at a fixed rate. Correct. Now we have a atria synchronized ventricular pacemaker, which means the upper and lower chamber are coordinated. Correct. It is sensing the upper chamber, it is pacing the lower chamber. And it is so well coordinated like the normal beat which is there.
And before we wrap up this podcast, any small message that you have for our listeners?
All I can say is please be very, very judicial about your health. Get your health checkups done regularly. Do give importance to your own life. And every hospital has good health packages available, One or the other package is there. Please get yourself checked at least once a year. Take that health package. So go to any good hospital, get the health package done, and consult a physician, a cardiologist. If you have rhythm problems, please consult a cardiac electrophysiologist. Thank you.
Well, thank you so much, ma'am, for sharing such wonderful insights. And I'm sure all the viewers and the listeners are going to gain a lot of knowledge from this. As we say, bradycardia was not really common as compared to this particular time period. But yes, people are getting aware with the pandemic, with the current situation of how our society is and the atmosphere is and how badly people are going to take care of their health. I'm sure this conversation is going to be fruitful for them. So thank you so much.
Pleasure, Kartik. Thank you.
Well, bradycardia is not just a slow heartbeat. It's a condition that needs timely attention and the right therapy. It's time you decode your rhythm. With innovations like leadless pacemaker therapy, we are redefining care, offering a minimally invasive solution that reduces infection risk, eliminates visible scars, and empower patients to live with greater comfort and confidence. When a heart device is invisible and seamlessly integrated, it gives patients peace of mind. Without constant reminders, they can focus on living fully instead of thinking about their condition. That's all for today's episode of Health Chacha with Medtronic. I'm your host Kartik, signing off. Until next time, stay informed, stay proactive, and take care of your health.